And so everything I have done for my mom, and I might cry, for the last 9 years has been fully out of pocket. And one of the things that I get so frustrated by is how people are not talking about how expensive it is to care for your loved one.
Jessica Guthrie left her full-time job to become her mother's full-time caregiver. Constance has been living with Alzheimer's disease, and the crushing cost of her necessary round-the-clock care were just too high for Guthrie. And millions of people are in similar expensive situations as Guthrie. Nearly half of states are on the brink of an unpaid caregiver emergency, according to a new study from Columbia University and sponsored by Otsuka. More people are being diagnosed with dementia than ever before, which leaves more of their loved ones with the task of caring for them. And those rising dementia numbers, especially in states that are cutting public health funding, means there's less resources for caregivers. Combine that with a shrinking healthcare workforce, many states are headed towards a disaster. It's especially bad for people in rural areas where shortages of home health aides are more severe, despite these areas often having the highest population of people over 65. And in high-risk states like Florida, the labor generated by unpaid family caregivers surpasses the economic impact of Walt Disney World. California and Texas have similar stats for their agriculture and cattle industries. So for people like Guthrie, is it any wonder it made more financial sense for her to be a full-time caregiver? And while caring for a sick loved one is a deeply honorable act, our government should be doing everything it can to ease the burden. Instead, too many families are being crushed by the unbearable cost of care they simply cannot afford.